The traditional, which is a standard film screen mammography, has been around for almost over 35 years. It uses a basic X-ray cassette, and the images are stored on a film. Then the radiologist sees it on the view box, and the images are stored on a patient's jacket in the facility archives. As compared to that, the digital mammography is like a digital camera. They're digital detectors which actually acquire the image, and then it's transferred onto the computer monitor and stored on the monitor and viewed by the radiologist on the computer monitor. The basic benefit for the patient itself, the initial procedure is the same. The patient still has to have her breast under the compression, still face radiation, but it's a much quicker exam. The acquisition time, because of these electronic detectors, is much quicker, so the patient has to be in compression or in that position for much shorter time. That does help with, since the exam is shorter, the radiation dose is shorter because X-rays are passing quickly and for shorter time. So that benefits the patient in terms of lower radiation to the patient, quicker exam time, and easy to keep the breast still for a shorter period of time. Also, digital mammography, over several trials where they've tried to compare how good is digital compared to a basic film screen mammogram, they found that it's most useful for women who are younger, no matter what their breast density is, but in younger women, especially under the age of 50, have found it to be, they have inherent increased breast density, and digital mammography by its ability to differentiate different contrasts is better for denser breasts. So it helps younger women, women with very dense breasts, or peri and premenopausal women where the breast evolution is so much and the breast densities are changing. It has been shown in multiple trials to be much more beneficial. And in this way, if you're picking up cancers in younger women, because it's better in denser, younger breasts, in a way you're detecting cancers. The hope is that you'll be detecting more cancers because it's more sensitive, and in this way, like detecting cancer earlier helps the overall survival of the patient, since the basic benefit is to get a quicker result and when the cancer is really small. The greatest advantage is that we can manipulate the image once it's taken. In a film screen mammogram, when the technologist takes the image, it's a film. You cannot change its brightness or the size of the breast. But since the digital images are acquired and on the computer, the computer system helps us magnify the image. So you can manipulate in terms of, if you see a particular area that you're more interested in, you can magnify without having to take an actual magnification view of that area. Plus, you can make it darker and lighter. So if there's some problem with the technique, it can be adjusted or compensated for by just manipulating the images. And that really helps, because if just for the technique, a patient had to be called back for a film screen mammogram, now because we can manipulate it afterwards, it reduces the recall rate for the patient having to come back just for manipulating the technique that the technologist initially took with. That's the biggest advantage for us in terms of being able to manipulate the images. The other benefit is it's the ease it's on the computer system. If I have a question about a particular mammogram, I can call up another radiologist. It's on the same computer system, so he or she can look at it. And even the referring physician, if he or she has a question, they can talk to us while they're looking at the same image as we are looking. So at the same time, you can talk about it. And this way, the interaction is better between the two radiologists or between the clinician and the physician. Also, the X-ray technologist, if she takes an X-ray and she has any question about it, she can call you right away. You can see it on the computer system. And if you want to make changes while the patient's still in the facility, you can do that at that point. So overall, it does help with also the advantages. You can store the images. They're not like lost. Sometimes their jackets, patients lose the images, or we are trying to look for an image and we can't find it because the films are lost. But on the computer system, it's stored on the computer and it's there for your access anytime, and more easily accessible. Yeah, definitely, because if there's any question, especially for diagnostic mammogram, when they come as a diagnostic, the radiologist has to see them while they're in the facility. But it's quicker that you don't have to wait for the film actually to be processed. Then somebody has to physically take it, and then the radiologist looks at it, then conveys it to the technologist or talks to the patient. Here, it's all the overall, each step is quicker because the downhill, you're looking at images quicker, you're communicating the results as soon. So it's easier for the patient to get the result right away, and that's another benefit. So the less radiation is also because the newer state-of-art systems that are used, they use really thin X-ray beam. They use like electronic detectors, like I said, and the basic principle doesn't change. You're still faced with radiation, still compression, but since it's quicker, there's less radiation, so the overall radiation dose, they say in trials, have almost decreased by 22% as compared to a film screen mammogram. The overall diagnostic accuracy is the same, but your sensitivity increases and there's lower radiation. Compression technology is needed for both, in terms of for the patient, it's the same. Like the breast has to be held in a compression between the two plates so that it's immobilized, and it's the same. The compression, the degree of compression, is the same in both, but the time that the patient needs to be under compression is less in digital. So it's in a way that helps with the patient being under the compression much less. The compression is really needed because it flattens the breast tissue, and so you want to make sure that you're not excluding any portion of the breast, so that all of the breast tissue is included on that film. And since it spreads out and flattens the breast, it helps spread the breast tissue from subtle abnormalities. So that helps with even a small group of calcifications, or a small mass will stand out when the rest of the breast is adequately compressed and is of even thickness. Also, because the breast overall tissue, the radiation has to go through a lesser amount of thickness of the breast tissue. Again, that helps with lowering the radiation. Also, because the patient, it helps with patient motion to get rid of it, so it's a sharper image. So all those are benefits of compression, and neither of the technique, is better or less than the other in terms of compression itself. So it says computer-aided diagnosis. That's like the theory behind like 4 eyes are better than 2 eyes. It's like a second reader, but having a second radiologist look at it is time consuming, it's expensive, and this is like the computer has adapted. They have software that helps the computer detect itself that a subtle mass or a calcification, that the computer will alert the radiologist to and highlight it. So if while looking at the image, the CAD picks up something, then your eyes automatically drawn to that and you can analyze it better. So it's like a second reader helping you and overall improving the sensitivity this way, that they are like, it's just like a double read. And this way it helps lower the recall rate. If you thought you were missing something, the CAD picked it up and you analyzed it better, there are less chances that you're going to call the patient back for something that you would have otherwise missed without the CAD having to highlight it for you. Mammography, you can detect like subtle calcifications that you would never feel, like either by yourself or the physician, and even the size of like a small pinhead with the state-of-art images that we get, you can detect them, and they're like really minute, and that is the basic difference in terms of you don't want to wait till it's cancer like showing, and because the quicker you show, the more treatment options you have. You're detecting it at a quicker stage. So the patient, once she's diagnosed, she has more options in terms of what can be the treatment options for her, And so all that helps a lot.